Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, Anita Finley.
It's lovely having two beautiful women in the studio here talking about how people can really be free of pain with something that's so simple, and I love when they come in. So I'm going to introduce you to Leslie Carmen, who's the clinical director of Carmen Care Advanced Laser Therapy, and Becca Kallaus, who is the marketing director for Carmen Care Advanced Laser Therapy. Welcome to our show.
Thank you.
Thank you.
Hi, Anita.
It's been a while now, and it seems that from the first time we met, you are soaring. Tell me what's going on.
Well, we're just growing every day a little bit bigger, right? And our success is just based on helping people and really being there for them and guiding them through the whole road of recovery in different ways. So we give them a really wonderful free consultation, understand their true cause of their problem, and then put together a custom protocol for their individual problem. And we treat them and we don't give up on them. That's one of the big things. So if sometimes people say it takes a bit longer, we know that. Some cases take a bit longer. You know, it's taken years for you to develop this problem. So sometimes it takes a bit longer for the treatment. And we just stick by our patients and just support them all the way. And that is paying off now. So because people say, you know, you guys really do care. And they're referring their friends, their family members and so forth. And we also have a great team. Becca, as you said, is here. You know her very well, too, and she's a great support, great marketing, does a fantastic job in broadening our company all over. So we're lucky.
So Becca, with that said, of course, you have this big smile on your face. You're so enthusiastic all the time. But how long does it take if someone comes in, let's say they have back pain, how long is it going to take for them, just for that one treatment, though, to get started? Is it 20 minutes? What is it?
Each treatment, we do half-an-hour appointments. Treatment time, like with the lasers on you, varies because we do a custom protocol with every single person. It's anywhere between 18 and 24 minutes of actual laser time. And how we do our treatment in our clinics is we always use 2 lasers on you at all times. So you're really getting double that treatment during that appointment. 2
lasers. Are people sitting down? Or are they lying down?
It depends on what the condition is. Whatever. We want everyone to be comfortable. That's most important. So, we don't believe in the no pain, no gain in our clinics. We do want everyone to be as comfortable as possible. So, depending on what the condition is, what areas we need to get to, and what the patient is suffering from, they could be laying down on their stomach or their back, or sitting in a chair, or we have a certain massage chair where you're leaning over, so that we can, we really make it as comfortable as possible.
So, Leslie, it's been said by many physicians that sometimes you come in with a pain in your leg, but it's really caused by something else. And how do you know that? Does your laser say, hey, you're in the wrong place?
Well, I was fortunate enough to be trained by Dr. Enrique Wolf, who is a neurologist. He's still our neurology consultant. And he showed me that there are specific dermatomes. So you look at the spine and you see the nerves, and we have books that show that, and you have the nerves that follow a specific pathway. And if your patient is saying, I have a really bad pain on the side of my knee or the side of my leg, and you kind of follow that, and you just know from asking them where is their pain coming from that it's usually the lower back. And so when we treat patients with their knees and they come to us and they say, we have really bad knees, we treat the knee, and within about 2 or 3 treatments they don't get better, we just know it has to be coming from the back. And as soon as we change the protocol and add the back, their knee pain goes away. So it's really interesting that a lot of pain in our legs, knees, foot, and so forth really come from the root cause of the back problems.
Well, Becca, you have something exciting to talk about, and I'm going to let you do that about this, taking this wonderful little, it comes in something that's larger than actually smaller than my purse. And what's in there, and what is all that about?
So we use a couple different lasers in our clinics. Now, one of the ones that we use very successfully is an amazing device called chromotherapy. That's the technology. And it actually uses 4 different modalities. So it's near-infrared, LED, magnets, and ultrasound. And all those different modalities work synergistically together, so they're really giving you the most efficient dose of energy to the body. So just a reminder, all of our treatments are completely non-invasive. So this laser specifically, it's so safe and so simple to use that you can actually purchase it for home use and treat yourself from the comfort of your own home. And but it's still a medical device, so we still use a pro version in our clinic as well.
And you're going to show me what to do.
Absolutely, and it comes with the case that Anita's talking about. It's a little carrying case that it comes in, so it's a hard case, so you can travel with it. It actually checks. I had somebody who she purchased a laser this morning, and she was giving her an introduction on it, and she's traveling to New Jersey in a couple of weeks, and she was concerned about taking it on the plane, and I told her, nope, it checks. You don't even have to pack it in your big suitcase. You can take it on the cabin. I've done it a couple times now.
Okay, so it's really portable in the sense that it has its own battery pack, so that I don't have to plug it in somewhere if I'm on the plane, really, do I?
It's very convenient. The portable battery pack that it comes with lasts at least 15 hours, and it's a USB port. So you can actually plug it into any USB port. So actually, while I'm at work, sometimes I'll plug it into my laptop if there's not an extra battery available, and that powers the device as well. So it's extremely convenient. It's very portable. It's very light. It's light. It's designed to be lightweight, so that's very easy to hold in your hand, even for somebody who has a loss of strength in their hand or certain dexterity issues. It's still very convenient for them to use as well.
So, Carmen, I'm going to get down to the nitty-gritty part of this. Why is this so magical? What is it that really? What is it with lasers now all of a sudden?
That's a really good question, because when I do a lot of research and see what is really behind all of this, and there are several things that are happening. The light that works together with the cell and releases the toxins, and there are all sorts of different things that happen. But when you go deep in, there are doctors that do a lot of this research, and they say, we don't really know. We just know it works. You really can't say exactly why is this laser working. But we can just see that it increases elasticity of the cells. So your muscles that are spasming become more elastic. If so, let's say you have the piriformis muscle in the buttocks that is pressing on the sciatica. We treat that, your muscle fibers become more elastic, doesn't press on the sciatica nerve anymore, and your pain is relieved. So many different things happen. You can see with the lights, with the color of lights, you're actually getting rid of bacteria. And there's even, there was what was his name? In 1940, I think there was a doctor who got a Nobel Prize for discovering that light is purifying water.
It was blue light.
Yeah, exactly. So if you basically take water, there are water purifying systems. You put it through blue light, it purifies the water, you can drink it. You have these little apparatuses where you put your medical devices in blue light and it sterilizes it. So this laser has this blue light. You put it on wounds, so it's going to be sterilizing the wounds. It regrows any kind of skin around if you have these bed sores. You put the laser on, it's going to close the bed sores, beautifully closed wounds. You don't have the virus or the bacteria anymore.
We're going to go back to that. You just hit on something extremely important. I want to tell everyone, if you're interested now, they will give you a complimentary diagnosis and help you so that you'll appreciate what it is. The phone number is 561-405-9577. That's 561-405-9577. Or you can go to their website, which is Carmen Care Laser, carmencarelaser.com. And the consultation, what is it if someone wants to come in, Becca, really for something like that?
Well, I just want to clarify first that the consultation, it's a consultation. We don't actually diagnose in our clinic. Okay. So, but we do a consultation. So that's the beautiful thing about the laser, is that it's supporting the body's natural healing system. So, whatever's wrong in your body knows what's going on. So that's why we have such a high success rate, because we're just supporting the natural healing system. It's completely non-invasive. There's essentially no risks. So it's truly an amazing technology. So.
Do you, either one of you can answer, do you think if someone is overweight that the laser can help them and just put it all over their body and it's going to make them thinner?
Unfortunately not. I mean, the laser does support your weight, so it will support your adrenal glands, and you can basically treat your carotid arteries and bring blood flow to your brain and your heart and just overall well-being. But overweight is usually also a change of life, right? If you're eating bad, you're also taking in a lot of toxins, and the toxins are also the things that actually cause disease. So there are three things that cause a damaged or diseased cell. Number one is trauma, number two is toxins, and number three is the belief. system that we have. So if you're going to be taking in a lot of these toxins and you're not eating well, right, because that's why you're overweight, your body's just not going to heal as well. And you're also going to not be able to get rid of that weight as easily as, someone else who's eating healthy and who's exercising.
So it's really very comprehensive, of this whole situation. And so people who are now, I know people are advertising this, plastic surgeons. And you see all sorts of people saying, we're going to get rid of this, your wrinkles, you're going to make you look 10 years younger. That's not really, though, what you're talking about, is it?
Right, exactly. They're right. The laser really works, and it will take away wrinkles and fat and all those things, absolutely. But we're focusing at this time, right now, just more on pain, because we feel pain is something that will, change your life. It inhibits you from enjoying your life. And we would like to really focus on a lot of the neurological problems, so the cluster headaches and trigeminal neuralgia, fibromyalgia, peripheral neuropathy, all those things that are life changing. If you can't feel well and move, you just can't enjoy your life.
Well, go ahead, Becca.
Well, and just to touch on the toxins that Leslie's talking about, we can now actually detox for most toxins and viruses from the body. So all of our therapies are completely non-invasive, but so we actually have that ability as well. So oftentimes there are certain neurological issues, autoimmune issues, food allergies, diabetes, sometimes weight gain, hair loss. Not saying that those are always caused by toxins, but they can be. And we can actually now detox for certain things that cause those issues as well. And we're just seeing absolutely incredible results. So, if that is a concern of someone's, then we can non-invasively help with that as well.
Well, we've been just talking about people who are having ailments. Well, is this something that somebody should just come in and have you do for them for general health?
Yeah, well, the thing is, what we're finding when we're detoxing people or testing them, we're finding people are having arsenic, and that's in chicken and rice, and that just makes you so lethargic. And it's really quite amazing. I think I've detoxed now 5 people with arsenic, and detox sometimes you think, is that invasive? We're going to do this through blood or urine and so forth. No, it's just a laser detox, and we can go into that a bit more specific at maybe another meeting, but. So I detoxed them with this arsenic, and within 24 to 48 hours, they come into the office. One guy said, I feel like Superman. And, and we detoxed Lee as well, because we're doing our whole office just to see, how things react. And she got up and she had to run around the whole block. She felt so energetic. So everyone that we're detoxing from arsenic gets this amazing boost of energy. And we must all probably have this in us, because we all eat chicken and rice, and we're subjected to all this outside, arsenic that we don't even really know where it's coming from, quite frankly. Like, why do we have arsenic in our food?
But toxins can come from anything. There's people who, they think that they eat really healthy. Oh, well, I only eat organic or raw foods, and I only drink purified water and all these things. Well, I've always taken lots of vitamins and supplements, and I hear people like that all the time. But there's certain things that are unavoidable, either the air we breathe, unless you're taking a shower and brushing your teeth in purified water as well, you're still going to be exposed to that to a certain extent. And then lotions that you use, hair products, makeup products, the clothes that you wear. I heard a story once of someone who got a reaction from a new shirt that they wore, and it was because there was a dye that was used and they didn't wash it before they wore it, and they had a reaction to it. So there's all sorts of things that can happen even if you do eat really healthy, but the majority of people do not eat healthy, and so therefore they have even more toxins and severe ones as well.
Well, I know this is a people show, but I guess my question about this is pets. What if you have a pet who's suffering from something? Would you believe that might help?
Yes, absolutely. I have a big dog. His name is Chi.
He's adorable.
And he's always getting hurt from daycare, because I put him in daycare during the day, and sometimes come home with a bruise or he got beaten up or something happened. And so we use the laser. And first of all, the wonderful thing about the animals is they feel the energy. They're so open. So they absorb this, and they're so thankful. And so he just lies down, and I just put the laser over him very gently, and he heals so fast. And he hurt himself once with a paw. They called me and they said, you got to pick up your baby, He's hurt. And he was limping in, and we lasered him, and within 2 days he was fine, and he was really hurting his hip. So absolutely with animals.
I was being a little facetious with that. That's very true, isn't it?
We actually have Carmen Pet Care, so we don't advertise for it too much right now, but we do have a Carmen Pet Care Facebook page, and we do have one of our employees. She's a groomer, and so she's our pet specialist, and so she'll actually go out and treat people's pets. And she's come back with some very interesting stories. She's had cats that are in a lot of pain that are just really antagonistic and not really don't look very approachable. And then you start treating them, and they completely calm down because they realize that it's helping, and they can feel they feel better. So you can see a huge improvement in the pets, in their energy levels, in their reactions to things, because they're feeling better.
And placebo, there's no placebo with animals. You still get a 90% success rate, because there you go. They love the energy. They just absorb it, and they're so thankful for it.
Oh, well, my dog's been a little bit fussy about eating. Maybe I need to, maybe. That's right, maybe something. Well, I mean, this is beautiful. I was being funny, but little did I know. I figure if it's good enough for human beings, it must be good for...
It is. Well, the laser actually started in the veterinarian field. That's how it started.
I did not know
back
that.
when, with rats and racing horses and things like that. Yeah, that's how it started.
Mm-hmm. And I actually spoke with a clinic who they've been doing laser for a long time, a veterinary clinic, and they actually have protocols that they are willing to share with us for any pet or any animal. They said even reptiles, so like for zoos and things like that. So no matter what the animal is, we can probably find a protocol for it.
We've gotten together. We want to volunteer for the turtles. Becca was online with that. There's some turtles that are having problems due to the BMAA that's in the river everywhere now, and they're getting...
I think it was the BMAA. I don't know specifically what was...
Yeah.
They haven't determined what toxin was causing the problems in these turtles, but there's these pictures of these turtles that have all these pustules, and they're suffocating, and they're very, very sick, and it's really terrible, and it's all over South Florida.
So you think that maybe the laser would help?
We have an idea. We're going to
we have an idea of something we think might help. So we will get back to you as to whether or not that did help.
That's what
how
the
amazing
big
would that
story
be?
is,
So
isn't it?
we are going to we're going to look into doing that
you
very
need to
shortly.
Get me a before and after. Get me a before picture of
that's
the turtle.
a guarantee. So if anybody is listening and has any contacts of somebody who can talk to the people who are in charge of helping the turtles and can hook us up with that, we definitely would like to help.
You all are just becoming. You're going to have your own hospital, Carmen Care Hospital. Pets, humans, turtles, whatever we're going to have. But this is lovely, and I know, Carmen, this holds a very special part for you because it was so personal, and that's why you started. And has your daughter ever had that problem again? You can talk about that. Has
of course.
It come back, or you have to keep doing this?
No, we haven't had to use the laser. She's in stress situations when it's very, very stressful in her life. She can get sometimes some shocks, but before it was like at a pain 10, throwing herself on the floor, screaming, and now it says she's still working. She says, "Oh, Mom, it hurts a bit. I feel some tingling." But one of the reasons why I've added this laser detox is really also because of her, because one says that trigeminal neuralgia can be caused due to the herpes zoster virus. And with the detox, we can detox the herpes zoster virus. So that's what really got me involved even more into this. And we're detoxing the virus now on her. And she had four. She had 4 herpes 1, herpes 8, zoster virus, and the herpes zoster vaccine virus in her. So as we were actually detoxing, she was complaining about pain and stinging exactly in her trigeminal neuralgia area. And since I've detoxed her of the 4 herpes zoster viruses that I found, she's now saying, "Mom, it feels like it's healing again. I feel like that first time after my first laser where it's tingling, but it's a healing kind of a tingling." And she said she's like doing so much better right now. But I mean, again, she had never really been bad to start out with. I just wanted to get rid of like everything, right? And have the possibility of getting her healed, 100%, that would be fantastic. So doing this laser detox on her has helped her again, another step.
But even with that, before the detox, she was, because I interviewed her to edit her story that we have online. Those are her words, that we have her full story online. But she said that she maybe had 2 to 5 shocks per year, and none of them more painful than a bee sting. And anybody who is at all familiar with trigeminal neuralgia knows that, shocks come very often and are extremely debilitating. So, that in itself is huge. But not only that, she plays on 3 ice hockey teams. So she gets beat up on a regular basis. Yep,
Yes.
in Florida. Yep.
Oh no, you all. Well, you're powerful women. I can tell you that.
But so she gets beat up on a regular basis. So she came in with this gigantic. She took a puck to the shoulder. It knocked her over completely, and her teammates all thought that she was going to be out for weeks or months. That maybe she broke something.
Right.
She lasered her shoulder about 10 hours after it happened the very next morning, and she only lasered the spot where the puck hit her. And in that spot, she took a picture 3 days later. There are no marks. She was playing hockey 5 or 6 days after this happened. Everyone was completely shocked to see her on the ice. But in the picture that she took, you can see that it's all sorts of pretty colors down towards her elbow where she did not laser. So had she not have lasered, her whole shoulder probably would have been very, very dark. So that picture is on all of our social media as well. So that's a fun picture to see a visual.
I would say that. Let me tell everybody, you're listening to Leslie Carmen, who's the clinical director, and Becca Kallaus, who is the marketing director from Carmen Care Advanced Laser Therapy. You can reach them by their office number, and that is 561-405-9577. Again, that's 561-405-9577, or go online. That's CarmenCareLaser.com, CarmenCareLaser.com. What is your daughter's name?
Lee.
Lee. That's referred to Lee.
Yep.
So you can see Lee's
Bruise.
before and after, right?
Right.
So one thing that's very common here in South Florida, and I don't know if it's aging, is lower back pain. People have a lot of lower back pain, and of course that means they can't walk. What would you do for someone if they came in?
Oh, my goodness.
Carmen?
We treat about 90%, I think, of our patients are with lower back pain. And I'm just treating a gentleman right now who has seen literally every doctor practically here, and they just can't really figure out what to do. I mean, they say surgery or injections, and obviously that's a way to go for many, but we say, no, try laser first. Let that be your absolute last option. So we treat anybody who has herniated discs or degeneration or, that piriformis muscle I was telling you. And we treat the entire lower back. So we even further up, so from the midsection all the way down. And we have this massage ball as well that does massage ball and laser. And we go deep into that muscle, the piriformis muscle, to loosen it up. And because we treat the entire area, we really are able to give healing to all the cells, to the bone cells, muscle cells, tissue cells, nerve cells. All of these cells get this energy and start healing, doing what they're supposed to do, because we forget we are really human beings that heal ourselves. If you cut yourself in your hand, that is going to heal. And we are always healing ourselves. I don't know if you're aware, but while we were sitting here, we just healed and lost millions of cells. So every minute, 96 million cells die. And thank goodness, 96 million cells regenerate. But so we are constantly healing. Our liver regenerates every 7 weeks. Our femur bone regenerates every 13 years. So you can't say no, bone doesn't regenerate. Yes, it does. It's probably regenerated 3-4 times in my life already. So laser will help with any kind of condition in your lower back. We just have to, really get to the root cause of it.
And I want to make sure everyone realizes there's no heat involved when you're doing the laser.
One of the ones that we use in our clinic does have a heat element to it. The laser that Leslie was referring to with the massage ball, our laser massage, that one has a heat element to it. We can also use it without the massage ball as well. But the one that you purchase for home use, and which we also use in our clinic, the one with the 4 modalities, that one you feel nothing at all.
I like heat.
Yeah, I know, right?
We like heat.
I know we like heat. Yep. And I just want to quickly say also for those people that are thinking about purchasing the laser, we give an over the phone consultation. So you're not alone. It's not that you get this laser and you say, okay, now what do I do with it? We support you all the way. So we give you a consultation, listen to the pain that you have, and then we put together a custom protocol for you. We can either Skype, we can do it over the phone, we can email. And if you have other questions along the way, we're supporting you as well.
But you have offices that people can come. A lot of people
Absolutely.
really want to be with you.
Oh, sure.
If you're local, you're always welcome to come into our office. But for anybody who, knows somebody out of town or somebody's listening to this outside of South Florida, they're welcome. We're happy to speak to anyone over the phone as well. I sold a laser to a gentleman last week who lives in California, and actually for his cataracts, was why he purchased the laser.
Oh, whoa. Okay, now we're getting into something interesting. Well, tell me about that.
So the only other doctor currently in Florida who uses this laser that we're aware of with the 4 modalities is an ophthalmologist. So, Anita, your face is so priceless right now.
I got to tell you, you are just going to hit a bonanza. Tell me what it does.
So, I mean, it's healing on a cellular level. So, that applies to all the different types of cells in your body. And Leslie was talking about the cells in your body regenerate, and every single part of your body regenerates at a different pace in terms of the whole area. But your eye, I learned this recently, but your whole eye actually regenerates every 2 days. So every 48 hours, cellularly, you have a whole different eye. So with this laser, it's very important when you're treating your eye to make sure that you're treating it twice a day, because, I mean, what's happening is the reason why we still have pain and toxins and damage to the cells, even though they're regenerating all the time, is because they're copying that same mistake. So with this laser, it's actually stimulating stem cells, which are basically blank slates, where they can turn into any type of cell. So they're not copying that signal anymore. So they're regenerating and rejuvenating each cell. So with treating it with this laser therapy, you're actually having it so that they're copying the correct cells, and it's also stimulating cell death. So that it's the cells that have the mistakes are dying off, and it's the new cells without the mistakes that are regenerating.
Just knows, huh? It is amazing. Isn't it? Well, let's go back to that then, Leslie, about the cataracts. Mm-hmm. What are they going to do? Is it going to prevent cataracts, or is it someone already has cataracts and is preventing it, them pushing it too fast to go and have surgery?
Well, but basically what we've seen, we personally are just starting this now in our clinic with the eyes, because we're learning from this, this ophthalmologist. But
we don't really treat in our clinic for the eyes. Mm-hmm. We in our clinic, we treat anything that's painful. But the laser, I mean, people, when you purchase this laser, it comes with a book with over 200 conditions that you can treat for, with general immune system, wellness protocols, any kind of pain, recovery from surgery or injury, or, anything you can think of just about. And then there's an eye, the nerves that run to your eyes. There's a protocol for that, but we actually have a custom protocol that we have for the eyes that's what I sent to the gentleman in California.
Yeah, we send that to our patients in addition if they have a problem.
We're going to be waiting for the next show to hear about this, because talk about pet care. My dog has not cataracts, but a little bit problem with her eyes. I have to put drops in. Maybe I need to do something. We'll have to talk about that.
Sure.
So there it is. Carmen Care laser for humans, for pets, and even maybe turtles. Okay, the phone number again is 561-405-0577. Go to CarmenCareLaser.com. Thank you so much.
9577.
What, did I say something wrong? 9577. Did I not say that? Sorry. Okay, we'll do it again. 405-9577. You're going to need to do something with my eyes, I guess. Okay. And we'll have you back again.
Thank you so much.
Thank you so much, Anita.